Princess Margaret is definitely not a place that rests on its laurels, and it's a place that's at the leading edge of advancements in new technology and image guidance and targeted therapies. And that's been seen in my own department through my department chief, Dr. Fifi Liu. And Dr. Liu understands how to combine advances in education and clinical care and science and technology to help ensure that Princess Margaret stays at the forefront of cancer care worldwide.
I think the biggest thing that I've witnessed in the time that I've been here has really been the development of the drug development program and the infrastructure that's now in place in terms of treating patients on clinical trials, especially clinical trials with new drugs that are being tested in patients for the first time. So 15 years ago, when I was a medical student at Princess Margaret, there really wasn't any sort of organized activity around early phase clinical trials, and now we have a thriving unit that has been successful in multiple grant cycles with the United States National Cancer Institute for the phase 1 and the phase 2 program. We have fellows who come from all over the world to train and who've gone back and become leaders in their programs and in their own countries. And we have patients who it's really rewarding to see who are taking part in these studies and really benefiting from having access to new drugs, some of which are individualized to features of their cancer, which we really didn't have the technology to test for before.
We had two fellows at Princess Margaret back in 1992, and I was one of the two fellows that was at Princess Margaret at that stage. Right now, we can say that we have 50 international fellows who are part of medical oncology. And I think that with the increase in size of our faculty as well as in our medical oncology fellowship program, I think we have started to drive research, innovation, and education in lots of different directions.
So I think the impressive things that we've seen in education over the past 20 years is really the move to this being an education factory. So education really underpins every aspect of the cancer program. We really believe that to promote rapid adoption of innovations, new technologies, new research and design, that you really have to have a strong education platform to bring that rapidly into clinical practice.
The patient is the center of the care, and then in the meantime, because you want to propose more options to the patient, we really have a big program for research. So that to combine both clinical and research side was for me the more amazing things. The second thing I think for Princess Margaret was also to work with really a good team, trying always to do the best for the patient, and also because we want to do the best for the patient, it goes with trying to find new treatment strategy and new options for them.
Anniversaries certainly bring up the opportunity to reflect on what has changed, and there's been so many significant changes in practice in these last 20 years since the move to University Avenue. However, for me, in the midst of the multitude of improvements, one of the aspects that has really been an anchor of organizational identity at Princess Margaret is the compassion that Princess Margaret nurses bring in caring for our patients. Oncology nursing requires a very special skill set, and indeed special people, because the qualities that oncology nursing requires is being able to balance the technical know-how and complexity, but also to be able to see and respond to the emotional side of the cancer experience, and to see and support the whole person in that process.